Surgery always carries risks, and most patients and their families understand that going in. What you don't expect is a preventable mistake. The wrong site operated on, a surgical tool left behind, or a complication no one warned you about. When that happens, the physical pain is only part of the damage. The emotional toll and financial strain can follow you for months or years afterwards. Surgical errors are among the most common forms of medical malpractice, and the numbers are staggering. The National Institutes of Health reports that medical malpractice is responsible for nearly 400,000 deaths in the United States every year. These aren't unavoidable tragedies. They are preventable mistakes caused by negligence on the part of doctors, nurses, surgeons, or others involved in a patient's care. Some of the most common surgical errors include operating on the wrong site or performing the wrong procedure entirely, leaving surgical instruments or sponges inside a patient. Anesthesia errors such as improper dosage, nerve, or organ damage from avoidable technique mistakes. Failure to monitor post-operative complications like internal bleeding or infection, and poor communication among surgical staff. The NIH identifies communication breakdowns and inadequate safety checks as leading contributors to surgical harm. If you believe a surgical error caused you or a loved one harm, building a strong case comes down to evidence. That includes copies of all related medical records and surgical notes, medical testimony confirming the surgeon deviated from accepted standards of care, proof of financial losses such as hospital bills and lost income, and documentation of any long-term complications or permanent disabilities. It's also important to act quickly. Maryland law requires most malpractice claims to go through a healthcare alternative dispute resolution process before proceeding to court. So understanding your timeline matters. Maryland Injury Lawyers helps victims of surgical negligence hold medical providers accountable and recover the compensation they need. Call or contact their office online to request a consultation today.